The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm your host, Don McIntosh. We're glad that you joined us today. We're going to be talking about the flu. Many different types of flu. Sometimes it strikes fear in the heart of some, but many times throughout the years we hear about it, especially in the winter months. Maybe getting a flu shot, this or that. We're going to be talking with Dr. David DeRose about this exciting and important subject. And Dr. DeRose, you've been a physician now for about 20 years.
That's correct.
Specialist in internal medicine. You've probably seen a lot of flu cases over the years.
You see all kinds of things in internal medicine, and then in preventive medicine, which is my other boards. I've actually worked with immunization strategies for a large hospital system at one point in my career, so was even more involved with influenza in that capacity than being in a general practice setting.
Now you have put all this experience together, and you have a rather flexible ministry now. You're able to do lots of different things. You work with different corporations, churches, individuals, groups, and you provide a lot of education on a lot of different levels, professional meetings, and also for the laity. And it's called Compass Health, and it's compasshealth.net.
That's it. If you want to find more information, that's all you need to remember, Compass Health.
A lot of free stuff. In fact, all free stuff on that website.
Oh, there's a few things you can purchase, but most of it is free and informational, educational materials.
So we're talking about avian flu or flu in general, so-called influenza. What is it, and how big a problem is it?
Well, it's a good question, because I can remember growing up that everything was the flu. Not everything. I'm not speaking of my household in particular, but you've heard this. I mean, someone said, well, Johnny couldn't come, he's got the stomach flu.
He's got the stomach flu, he's got the ear flu, he's got the nose flu, all kinds of
yeah,
flu.
I mean, most people are very nonspecific when they use the term flu. It's just like a cold, or, colds and flu we often say in the same breath.
Flu.
But influenza is a very serious, really, viral illness. And it's serious for a number of reasons. One, if you get influenza, you're going to tend to get pretty sick, at least if you get the full-blown influenza.
Throw up, dehydration.
Not necessarily. You can get the GI stuff, but definitely high fever is classic. Cough, these are two real hallmarks, and then just feeling really bad, really wiped out. These are probably the three most consistent things that we see with influenza. Sore throat, intestinal things, yeah, they can be part of the picture.
I mentioned at the beginning that many times we hear about this more in the winter months. Why is that?
Well, actually, there is a peak, there's a spike in influenza cases, at least here in the northern hemisphere during the winter months. It appears there's a number of reasons for that. One actually has to do with the virus itself. It does seem to thrive more at colder temperatures. But also, it has to do with the close proximity that we put ourselves into during the winter months. We're not outside as much. There is more congregating indoors. At least that's the take from the infectious disease community, that there's more than one thing happening that then provides an opportunity for these influenza viruses to circulate. And they're very infectious germs. A good example of this is an airplane flight. It's actually been studied. If you're on a flight for 4.5 hours, a long flight, okay?
Yeah.
Maybe flying cross country, whatever, and someone on the plane has influenza and they're coughing, 75% of the people on that plane are going to get influenza. That's what some of the data indicate.
Is that right?
Yeah, and it's incredible.
So where should you sit on the plane?
I think there's some other strategies that may be more effective. And to get to those, let me mention an interesting thing. A lot of people say, I don't need to be concerned about influenza because I never get sick.
Okay.
But there's a problem for us as health professionals, clergy, people that are working with individuals, caring for elderly parents.
Right.
There is a significant percentage of people who, when they're exposed to the influenza virus, they develop what is called an inapparent infection.
Inapparent infection. They've got it, but they don't know it.
That's right. They actually have the virus. They're transmitting the virus when they breathe. They can transmit it through their hands if they rub their nose. Whatever the case may be.
Shake hands.
Shake hands. And people around them can get the virus from them. This is why, when I was in hospital infectious disease control, we encouraged all our employees to get the flu vaccine. Not for themselves, but especially if they're working in the intensive care unit, they need that vaccine
to protect the patients.
Protect their patients.
So this is very dangerous. How dangerous is it? I mean,
to put it in perspective, you need to recognize that influenza does not always raise its head in the same way. Influenza is a fascinating virus. And I say it's fascinating because, you know, most of us think in terms of a virus being one thing. We can, you know, take a develop a vaccine and immunize for it. Your kids, no doubt, have probably had some vaccinations done.
yes.
And so have mine. And those vaccines, let's say the vaccine was for measles.
Measles, mumps, rubella. All
Okay, measles, mumps, and rubella. All three of those, three different viruses, they get one shot, and all they need is one booster. We used to just give one shot. So how did we protect them from three viruses
I don't know.
with one or two shots?
Never thought about this. How did you do it?
Well, just wait. And,
Okay.
it's not the whole question. And with influenza, you're supposed to get a shot every year.
Yeah, how is that?
What it is influenza is continually changing.
Morphing.
Morphing. Good way to describe it. Okay?
Thank you.
It's got these surface projections on the virus. They're actually technical names for them, but for short we call them the H and the N projections.
Okay.
Okay? And this has to do with the viral characteristics. The H factor has to do with its infectivity, its ability to infect other cells.
Okay.
And then the N has to do with its ability to release itself from the cells after it takes over their genetic capabilities and starts using the cell's own genetics to make new viruses.
So that's how it can all change.
Yeah, these H and N compounds change over time, especially the H. This has been the most studied. It stands for hemagglutinin. This H factor changes over time. It does what we call drifts over time.
Drifts into something different.
Into something different, just very gradually. But, now why I'm answering the question this way, Don, if there's just a little drift in change from one year to the next, which is typical, if you're exposed to influenza next year,
Okay.
the immunity you had this year will be partially protective.
So it doesn't totally go away, but it's not going to totally do the job.
Yes, you're not likely to get a severe influenza case being a healthy young man like you are.
Thank you.
Okay?
Okay. Good.
Now, if you were debilitated and old, that's a different story. And that's why we urge people that have chronic medical conditions, or if they have immune compromise, or if they're in crowded situations with lots of susceptible people, like in a nursing home environment, that these people have a priority when we're immunizing for influenza each year. I've just told you about the drift, though. There's something else that happens with influenza viruses, bigger changes called shifts that occur.
Okay.
And some of the most dramatic shifts in influenza would be an actual change in the whole type of the H and N factors.
So if it was H1N1 and it moved to H3, H4, that's totally different.
That'd be totally different.
That's not a shift, that's a leap, or whatever you call it.
You may call it a shift instead of a drift, or,
Okay.
or a dramatic change. And so
the body's not ready at all.
The body is not ready for it. And what we've been seeing historically over the last several decades, we've been seeing H1N1, that's one variety, and the other variety we've been seeing is H3N2. We've been seeing variations on that. What people are getting very concerned about is the emergence of another pattern, which is H5N1.
H5N1, so that's totally different.
Totally different. Still influenza virus, but these different surface projections.
And so there's no real way to fight against it.
We don't have the immunity developed against H5N1.
So is this why, during in 1918, around that time, they had the so-called swine's flu? That was a totally different H1N,
well, actually,
H and N projection?
Yeah, this is very interesting. And now, I don't know where they get these specimens from. I haven't looked into this, but supposedly, and it's coming from reputable scientific sources, there are actually specimens that date back to 1918. This great flu epidemic killed 21 million people. That was what we call a pandemic.
That was huge.
It was huge, sweeping the whole world, something like 500,000 deaths here in the United States.
All traced to the pigs.
Well, the interesting thing about this, Don, is when they've looked at these, when they looked at these specimens, they were saying they were H1N1. Now some of the latest stuff that's come out is saying that this was an avian flu.
Avian? It wasn't the pigs?
It wasn't the pigs. It was an H5N1, but the pigs may be part of the story.
Well, okay, how do the pigs factor in?
It's very interesting. You and I have studied some of the biblical counsel about health.
Don't eat pigs.
Don't eat pigs.
And don't eat most birds.
But you know what? Think about it. If the whole world was following God's counsel about pig not being a consumption item, how many pigs do you think there'd be in the world?
Probably a lot more than there are now.
A lot more than there are now? Because people wouldn't be eating them, or what?
Right, because people wouldn't be eating them.
Well, I mean, sure, there'd be more pigs in the wild, probably. But most of the pigs that we've got today are domestic pigs. You see?
Yeah, they have them in farms.
Exactly.
Okay. All right, I see what you're saying. Right, so there'd be a lot less pigs, and they'd be in the wild roaming around.
So let me come to this scenario with you.
Okay,
because we're talking here about H5N1. This is the so-called avian flu.
Right.
It's been getting a lot of attention since 1997 or so, when we started seeing these outbreaks in Asia. People who were in close proximity to birds getting this so-called avian flu, H5N1. This particular virus, up through like 2005, no human transmission of significance. Only if they're in close proximity to birds, a few household contacts getting it from another human, but very, very difficult to transmit human to human. No potential in the avian flu virus to cause a pandemic.
Okay, then
Now,
what happened?
Coming back to 1918.
With the pigs.
With the pigs and with the pigs today. One of the theories with how avian flu can morph into a virus that can then affect humans is there's some type of third host.
A pig.
Like a pig, that is susceptible to both human influenza virus and avian
And it mixes them
virus.
Together.
That's right. It gets a co-infection or somehow transmission of viral material, and voila, you come out with a virus that's susceptible for human-to-human transmission.
And then someone eats the pig, and they get it.
Well, presumably, it's transmitted aerosol route, not necessarily by eating the pig.
Interesting. So that brings those two together. So is there, there's more and more interest in this bird flu, and sometimes people would call that a scare tactic, and some people would say, hey, but you're saying there is really something to be concerned about?
Oh, no, this is a legitimate concern, and we need to talk about some practical things on these matters.
Well, we're talking with Dr. David DeRose. We're talking about flu, different types of flu, and he's described to us some of the mechanics of how flu is both produced, the different viruses, and now we're going to talk in the second segment about how we can avoid it, and I think you'll be very interested in that as well. Join us.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Diehl and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Diehl and Dr. Ludington have been featured on 3ABN, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call her right today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call her right today.
Welcome back. We're talking with Dr. David DeRose. He's a physician in southern Oklahoma, and you have a ministry called Compass Health. A lot of the different things that you produce, you're always doing ongoing research. You're always coming up with new presentations based on the needs of people around the world, and this is one of the needs. People are really concerned about flu, but more specifically bird flu, because it's now been transmitted, I guess, in some places in Asia and maybe other places. I don't know at the airing of this program what will be true, but it's been gone from birds somehow to humans, and this is causing great concern.
Yes, but remember, what's happened, up through 1997, 98, 99, up through 2005, is this transmission was just going to people who were handling the birds predominantly. Very rare exceptions, but very high fatality rates. We're talking like 50% of the people who are getting this H5N1 through this intimate contact with birds that are actually succumbing to the illness. So very serious. And that's why earlier in the program we talked about how bad influenza was. Yes, you may have had influenza last year.
But it morphs, it changes.
That's right. If you're exposed to the H5N1, if that somehow morphs into something that just goes between birds pretty much right now, into something that readily can go from human to human, we are talking about having a worldwide pandemic. This is going to sweep through populations because we don't have immunity to this form of virus.
So it's totally different than, like, say, you get your measles, mumps, rubella, which once you see it, your body sees it, it's always ready to attack that. But this is always changing. It's
That's right. That's
morphing, and that's why there's concern. So vaccinations, flu shots, should people be getting those? But will they help, or they're not even really related?
Well, right now, we don't have a flu shot for the H5N1 variety.
Which is the avian flu.
This is the avian flu. And part of the reason for that, at least from my looking at it, and again, I'm not an infectious disease expert, I'm not a virologist, so I'm looking at this through the eyes of an internal medicine and preventive medicine physician, looking at the literature. What appears to really be the problem is we don't have a target yet, because we don't have a virus that has mutated, if you will, or transformed or morphed or whatever into a humanly transmissible form. There's not really a practical reason to make a vaccine right now to try to counter the avian virus as it is, because this is not posing a human threat. That's not the virus that we need a vaccine to. Do you see my point?
So what do we need it to?
Well, the problem is we're only going to know what the perfect vaccine is for the virus that's being transmitted from human to human once that virus emerges.
Okay. So right now it's only been transmitted in rare cases from birds to humans, but it's never gone from human to human.
Rare cases gone from human to human, maybe 150 cases.
Well, why can't they take those rare cases and figure out what the vaccine should be based on that?
Because we're not worried about that virus right now as far as causing a pandemic. You don't need to be immunized right now, Don, against the H5N1 that caused the death of some poor woman in Vietnam, because we don't have that virus here. And that virus is not going to circulate around the globe because it doesn't have that potential. I mean, that's my best way of reading the literature, and I understand that people are working on H5N1 viruses. In fact, there's
vaccinations, or
yeah, they're working on. They're looking at all the possible forms of H5N1, and they're trying to develop vaccines that counter each one. So, in case one of those is what begins affecting humans in a pandemic way, they've got these vaccines developed. At least that sounds like one of the strategies from my reading of some of the summary materials.
Okay, so we don't have anything to really worry about for sure on that right now, but in a general sense, how could we, is there any way to protect ourselves against a new strain?
Well, let's talk about it. Let's say it happens.
Okay.
Let's say as this show is airing, just the program before that was live, they had someone on saying, we've just had 1,000 people die in our town for the second day in a row from avian flu. H5N1 is here, and now people are watching this pre-recorded show. What can they do? We want to give them that message. The first thing is get whatever immunization you can against influenza. Even though The H3N2s, the H1N1s may not provide a large degree of protection. They may provide some.
And every little bit helps.
Yes, and beyond that, they're going to prevent you from co-infection because you can get both H5N1 and an H3N2 at the same time, theoretically.
Okay.
Okay? So get the vaccination, and especially if you're in a high-risk population, if you've got asthma, if you've got chronic lung disease, if you have heart disease. These would be high-risk populations, over 65. All of these scenarios, you want to prioritize getting the flu vaccine.
So get your flu shot, get your vaccination, any medication.
Well, there are medications. There are antiviral drugs. There's actually 4 currently available in the United States. Amantadine and rimantadine are 2 of the older drugs that are available. These drugs are very interesting. It does seem that they have a role in preventing influenza outbreaks. But if you use a drug, let's say in a nursing home or in some other close community, if you give someone amantadine as a treatment drug, the influenza seems to rapidly develop resistance to it, and the other people taking amantadine are not protected. It does not help them.
Wow, so that virus is so smart, so to speak, that it changes and it kind of knows its environment.
Exactly. So most people are saying, for a variety of reasons like that amantadine and rimantadine are not viable strategies when it comes to a pandemic of the H5N1. But there are 2 other drugs sold under the trade names of Tamiflu and Relenza that are reasonable strategies. Tamiflu is an oral drug. Relenza is an inhaled drug.
And that's why, you know, many countries are developing that, and they're building places that can make more of this just in case.
Exactly. They're really trying to stockpile this, especially the Tamiflu. It's from a natural plant. It's from a plant source. And the Relenza is, being an inhaled drug, is a bit more cumbersome to use. And for people that have respiratory problems, it may not be the best route to use, because there is some reports, at least, of people with asthma or other things having actually some serious reactions to an inhaled form of this medicine.
So let's say the vaccine's not available to me, the drugs are not available to me. What should I do?
Okay, several things. First one is don't wait until an outbreak occurs. Don't wait for the pandemic. That's when you're not going to be able to get the vaccine. That's when you're not going to be able to get the drugs. Make sure you're vaccinated before the pandemic, okay?
So if you don't have a vaccine and you can't get one, and you're saying just keep looking till you get one?
No, what I'm saying is that should have happened before this discussion.
Okay,
okay?
Good. All right.
Now we're at this point. You can't get the vaccine. You can't get the oral drugs. What are you going to do?
Right.
First thing is hygiene. Okay?
Hygiene.
And
clean. Wash.
Yes. Cleanliness. It's watching your contacts. I mean, in other words, don't go on that cross-country trip if there's a serious influenza outbreak in New York City. Don't get on the plane in New York City with all those passengers. Cancel your plans if you're concerned about it, and you should be concerned about it.
Mm-hmm.
Okay? So that's a hygienic measure. Sure, washing your hands is important, but the aerosolized route, what's in the air, is probably the most efficient way that the influenza virus is transmitted. Wearing a mask actually can afford protection. It's good for the person who has influenza to wear it, but they can be transmitting it for a full day before they have any symptoms. So if you're concerned, wear a mask when you're out in public.
And that's why we saw a lot of pictures of other countries where
that's right.
That's scary. They're all wearing masks.
In some countries, that's common practice. Here in the United States, we'd think it wasn't macho or something to be walking around
or that
wearing
we're
a
a burglar or something.
Yeah, exactly, whatever the case may be. But I'll tell you something even better than all that.
What's that?
It's keeping your immune system up.
And how we do that?
Well, there's several ways. I mean, first of all, you think about the high-risk populations, okay? One of them are people with chronic obstructive lung disease. Cigarette smoking not only causes obstructive lung disease like emphysema, but it also lowers the resistance in your respiratory tract.
Sure.
If you're concerned about avian flu and you're a smoker, you need to stop smoking. And you don't want to wait until the avian flu outbreak is upon us.
Right.
Because it can take literally weeks for those little cilia, those little hairs that clean out the lung system, to resume normal function or regain function.
So everything you would do, I mean, all the normal good things, good nutrition, exercise, not smoking, not drinking, all those different things are what you need to do to get yourself healthy.
I'll tell you another huge one
What's
is
that?
adequate sleep.
Adequate sleep.
I mean, this is one where many people cut corners. I mean, you know it. I mean, in our profession, sometimes we have to do it, right? As a physician or a pastor, I mean, someone calls us at 2 in the morning.
Got to go.
Yeah, you got to go. If they have an acute need for ministry, we've got to go. But Don, many people are cutting corners when it comes to their sleep. You know, they're trying to save a few dollars. They're not going to stay in the hotel. They're going to make the cross-country drive.
Sleep in the car.
Yeah, sleep in, you know, take turns, trade off, whatever it might be. You don't want to cut corners, especially when you're in a pandemic territory, if you will.
What if we get sick and can't get treatment?
Well, if you get sick and can't get treatment, I'll tell you an interesting story. A physician, a seasoned physician with a lot of experience in natural remedies, told me that, that they had a friend who was giving hydrotherapy treatments back in 1918 during the flu epidemic. And any person they saw who came to them for treatment, who could walk in, even with assistance, they didn't lose. These alternating hot and cold treatments to the chest seem to be life-saving. Now, I can't tell you any study that I've seen that shows that, but I've heard a lot and I've seen a lot, even in my own experience, that these things do make a difference.
You know, the Bible says that at the end of time, people's hearts will be failing them for fear, sometimes over, you know, what's happening to them or what they think might happen. People should be concerned, but what can you say about fear?
Well, actually, fear is immunosuppressive. Okay? If you get scared and anxious and worried, that tends to suppress the immune system. So you definitely don't want to be deathly afraid of getting the flu virus, or you're more likely actually to get it.
So we have nothing to fear but fear itself.
That is one of the things we do need to be afraid of.
Okay, and some of this information, you know, we've summarized a lot of things, some of it a little bit technical about how the virus can morph, why it's dangerous, why it's different than a bacteria, all those different things. That's available on compasshealth.net.
We've got some general information there as well as some links to sources that can really provide more information.
Well, you know, I'm glad that you were a physician in internal medicine and preventive medicine. That was great, but I think this is even better. It makes it more accessible to other groups, and thank you for the ministry both here today and also on the website.
You're welcome, Don.
And thank you for being with us. And thank you also for being with us. Very practical lesson today. Take all the precautions you can. If you can get vaccinated, if you can get those different things, every little bit will help in a flu outbreak if it comes in your area. And then just do the basics. We've learned that from Dr. DeRose today. You want to review those, go to compasshealth.net. We're glad you joined us today for Health for a Lifetime, and we trust this will be good information for you.